middle adulthood, and late adulthood, chapters 11 and 12. So let's go ahead and get started. Middle adulthood, chapter 11. Middle adulthood runs from age 40 to 65. Traditionally, it may be the most productive period of a person's life, though the end of middle age probably signals retirement, not for me, but for everybody else. There are potentially many changes during this time period that point toward a slowing down. Ageism is unreasonable and irrational beliefs concerning people as they age. Modern society relishes youth and denigrates aging. Physical attractiveness, and when we talk about modern society, we're talking about modern Western society. Eastern society embraces their elderly, but Western society does not. Physical attractiveness is defined by youth, and people insult those who show signs of not fitting into their definition of attractive. People reaching middle age will spend tremendous amounts of money to appear young. There are reasons why the aging process is not well understood. There are many factors that are tied into that, which include life trauma, the environment you live in, the diet that you eat, the debts that you accrue, such as tobacco, alcohol, and drugs, and genetics. Some people only live into their 70s, and that's part of their genes. My family, luckily, both sides of my family live into their 90s and hundreds. Environment. This is where I lived in Montana. That's what it looked like. As you can see, there's nobody around. It's just one long road. The diet that you eat, sure, yeah, go ahead and have those. Supersize everything. The traumas that you experience. This is the refugees from the Middle East coming into Europe. The debts that you accrue. And of course, this lady is shooting up with, it looks like probably, it could be crystal meth, I guess. Life expectancy is the statistical figure as to how long an individual can expect to live. It is actually a statistical average of how long people do live. Every country has its own life expectancy. Third world countries tend to have significantly lower life expectancies than industrialized countries. The countries with the lowest life expectancy are all African countries. In Malawi, the life expectancy is only 37.6. Mozambique, 37.5. Zambia, 37.2. The three countries in the world with the highest life expectancy are Japan at 80.7, Andorra at 83.5, and San Marino at 81.1. San Marino and Andorra are tiny countries in the Pyrenees Mountains of Europe. The Pyrenees are between France and Spain. Those are the Pyrenees. Andorra has only 68,000 citizens, and San Marino has 27,000. Flagstaff has 72,402 people, and Gallup has 21,854. So these countries have about the same number of people as Flagstaff and Gallup. Life expectancy in the United States is 76.5. The increase in life expectancy in the United States is partially due to a decline in the infant and child death rate in the United States over the last 50 years. When I was born, life expectancy in the United States was only 59, and that's because so many people smoked, and they were cutting their lives short due to smoking. Heart disease has been cut in half in the last 30 years. Death during childbirth is rare. Being female is a factor in longevity. 58% of people over 65 and 70% of people over 85 are female. Wait a minute. Okay. While life expectancy is a theoretical speculative number, longevity is actually the length of time an individual lives. Many people desire longevity, but most fear extended chronological age, actual number of years, in decrepitude, inability to function on one's own. Biological age is the physical age of the body in comparison to the chronological age. Both my parents lived into their 90s, and both of them were fairly lucid and fairly functional up until they died. So I'm not scared. The longest recorded lives have been in the 120-year range. Many gerontologists, literally old man studier, feel that 110 to 120 years is the upper limit of human genetic endurance. However, with advancing medical research and less traumatic lives, other scientists are predicting longer and longer lives. Many scientists see no reason to place a fixed limit on longevity. What people look like tends to be genetically dictated. Thus, people from one group may look old at 30, while another group maintains their skin elasticity and hair pigmentation into their 60s and 70s. When I was on Fort Belknap, I had a friend who was almost exactly the same age. We were born almost at the same time. I have white hair, and he didn't have the first white hair in his head. And he had been an alcoholic for 17 years, and here he was. Exactly the same age and no white hair. But me, I have a full head of white hair. Young adults tend to have smooth, taut skin, and their hair has color, fullness, and sheen. Today's 20-year-olds are taller than their parents, and they tend to reach sexual maturity earlier than in past generations. This trend is believed to be due to improved nourishment, healthcare, and less physically stressful lives. Most young adults tend to be quite appearance conscious. They tend to maintain a slim, lean physique and wear clothes that accentuate this aspect of their appearance. As individuals approach middle age, their appearance tends to change. Skin elasticity decreases and facial expressions begin to mold people's faces into character lines. Both men and women begin to suffer from middle age spread, men tending to take on a spare tire, and women to grow larger thighs. Fat replaces muscle, and that's what we're looking at here. Like, boom, there she goes. Okay. There you go. There's some guts on those guys. By late adulthood, physical changes become more obvious. Skin loses some of its color, hence the desire for tan skin among Europeans, and becomes splotchier. It begins to hang in folds and wrinkles and takes on the texture of parchment. Varicose veins may form in the legs, hair may turn white and thin, hair may begin sprouting in odd places, ears for men, chins for women. Individuals may begin using plastic surgery, heavier cosmetics, or Botox to rid themselves of age lines. They may deny their age and seek symbols of youth. They may take on younger lovers. Structural and functional changes. Joints. The joints are protected by a smooth protective cushion of cartilage. This is known as your meniscus. With age and use, the cartilage deteriorates and the smooth surface becomes pitted. Bones become less dense, especially in women who have menstrual and postpartum birth drains on the calcium supply that may leave the bones brittle and porous. Calcium is constantly being replaced, but in women, bone density loss begins to occur in their 30s. Male calcium loss in the bones doesn't begin until they are in their 60s. Estrogen plays an important role in keeping blood calcium levels normal. In women, the estrogen promotes the absorption of calcium from the blood and into the bone. When estrogen levels fall, women no longer have the protection of estrogen to protect their bone mass. One of the most vulnerable bones to a female is the hip bone. A woman over 65 has a 1 in 5 chance of breaking her hip. Large bone fractures take much longer for an older individual to recover from than a younger individual. Osteoporosis, or porous bones, is a disorder of old age where the bones become thin and brittle because of calcium depletion. 1 out of 4 women in the United States suffer from it. It is estimated that 1.3 million fractures a year in the United States are the result of osteoporosis. The spine is especially susceptible to the problem and is characterized by the classic hunchback posture. And I have seen this, I've seen this a lot. Of course, I've seen it a lot because I worked in medicine, but I worked in X-ray. But I've seen it on the reservation. I've seen women with a characteristic hunchback. Osteoporosis is more prevalent in white females and more pronounced in women of fair skin and small frames. Proper nutrition and exercise that begins in youth is followed throughout life can help prevent osteoporosis. Smoking can exacerbate the problem in that it ties up vitamin D that is needed for the proper function of calcium. Arthritis is a general term that refers to inflammation of the joints. Arthritis is common in older individuals, but it can be found in younger people as well. Nearly half of people over 65 suffer from some form of arthritis. Osteoarthritis is the most common type of arthritis in the aging. Osteoarthritis represents inflammation and swelling in the joints. It is also common for this problem to be present when the joints begin to degenerate, and that's what we are seeing here in the wrists and in the hand. This is the hand right here. You can see all the swollen joints, extra cartilage extra cartilage there and here, and look at that. That's the ring finger on her right hand. Wow, look at her thumb. What a mess. What a mess, what a mess, what a mess. Where did we see that? We saw it somewhere, didn't we? The lady with the bad hands. Maybe not. Okay. Rheumatoid arthritis is a crippling disease that progressively destroys joint tissue. 70% of the cases appear between the ages of 25 and 70. It affects 75% more women than men. It's an autoimmune disease. Cartilage becomes damaged and the joints become deformed, sometimes fusing together. And that's what we saw there. Most people detect little effect of aging on their sensory motor systems until they reach the age of 50. At that point, hearing losses become more obvious, presbycusis. That's called presbycusis, which means old ears. And the lens loses its flexibility, causing presbyopia, which means old eyes. Presbyopia is usually in the form of farsightedness and may require reading glasses, and that's what I use. I use reading glasses. I have them on right now. My glasses are twos. For the longest time, I was wearing 125s, and then I started wearing 150s, and then I started wearing 175s, and now I'm up to twos. So, yeah, my eyes are getting worse. But I'm 73. What do you expect? What do I expect is a question. As the individual ages, it becomes more likely that a disease will cause excessive pressure in the eyeball, damaging the optic nerve, a condition known as glaucoma. I have a brother with glaucoma, and he has to put drops in his eyes every morning in order to reduce the pressure in his eyes. As people reach middle age, many of their senses begin to decline. Besides presbyopia, some individuals may suffer from a yellowing of the lens, which filters out green, blue, and violet lights, making color acuity poor. If the lens clouds and becomes opaque, cataracts will form, making vision blurry and out of focus. 1.3 million cataract operations are performed in the U.S. every year. Older individuals will require more light because of pupil problems. What can I say about cataract surgery? It's done by lasers now, and it's fairly easy and it's fairly common. Once upon a time, it was rare, and if you had cataracts, you could just forget it because there was nothing they could do. Well, they could. Then they started doing surgery where they would scrape the eyeball with a scalpel. And of course, then it had to heal. It doesn't take very long for the eyeball to heal, but it was kind of a dangerous process. Now it's not so dangerous at all. As people drift into middle adulthood, the sins of their past often will catch up with them. If they have not maintained a healthy diet or maintained a frequent exercise regimen, these practices may haunt them in middle age as damage to their cardiovascular system. Atherosclerosis is the buildup of plaque in the walls of the arteries that may block or slow blood flow from a fatty diet. Arteriosclerosis is a loss of elasticity due to the hardening of the arteries from lack of exercise. Because of athero and arteriosclerosis, blood pressure is raised. Blood pressure naturally increases with age, but genetics and these conditions can lead to chronically elevated blood pressure or hypertension. This can lead to kidney disease, heart attack, or stroke. Hypertension can usually be controlled through improved diet, exercise, or medication. The system that tends to show the least wear and tear from aging is the digestive system. However, as an individual enters middle adulthood, digestive problems can arise. Ulcerative colitis, absorption problems leading to poor nutrition, gallstones, ulcers in the stomach, ulcers in the duodenum, hemorrhoids in the rectum and anus. And this is an ulcer in somebody's stomach. As you can see, it's just a raw spot, but it hurts. Another digestive problem that tends to occur during middle adulthood is type 2 diabetes, where the cells of the body become insensitive to the body's insulin. Type 2 diabetes becomes a problem with people who carry their fat in their gut and lean toward obesity. There's also a genetic component to this problem and is seen in select populations, especially American Indians. Type 2 diabetes may be associated with age, with obesity, physical inactivity, diabetes during pregnancy, family history of diabetes, prediabetes, and high cholesterol and high blood pressure. One of the most significant aspects of a female's life is her menstrual cycle. For 40 years, a woman's monthly cycle floods and depletes her system of hormones, controlling her reproductive capacity, and in some cases controlling her moods and affecting her behavior markedly. During ovulation, when intercourse is most likely to produce a pregnancy, a woman's sight, hearing, and sense of smell are the most acute. During menstruation, all of these senses are the most dulled. Menopause takes place when a woman permanently stops ovulating and menstruating. Menopause usually occurs about a year after the woman's last period. Often women will ease into menopause over a number of years when their monthly cycle begins to become erratic. This is known as perimenopause. The process begins about age 30 when a woman's production of ova begins to decline. As a woman approaches her 50th birthday, she begins producing less and less estrogen. Menopause occurs when the ovaries no longer produce enough estrogen to sustain full menstrual cycles. In 80% of women, menopause occurs between 45 and 55. When I was working in a rural health clinic in Oklahoma, we had a woman that was 75 and she was still having periods. She was funny. She was a hoot. Anyway, she was 75 years old. She was still having periods. And of course, she called it some really funny things because she's been having periods for 55 years. Well, longer than that. She'd been having periods for 60 years. She was funny. 75% of women experience little or no physical discomfort due to menopause. The most common symptom is known as hot flashes, sudden contractions of blood vessels causing blood to flood to the surface of the skin. Some women have hot flashes constantly, while others have none at all. Other symptoms of menopause include vaginal dryness, vaginal burning, vaginal itching, urinary problems, vaginal infections. Menopause causes the vagina to become shorter and narrower, and the walls become thinner and less elastic. Lubrication diminishes, which may cause discomfort during intercourse or irritation to the bladder. Vaginal secretions become less acidic. Since the acidity of the vagina protects the woman from bacterial and yeast infections, she becomes more susceptible to infection. Oddly, the more sexual activity a woman the more sexually active a woman is, the less drastic the changes in her vagina during menopause. Other symptoms of menopause include joint pain, muscle pain, headache, insomnia, fatigue, dizziness, weight gain, constipation. Since the hormones that control menopause are the estrogens and sexual desires controlled by testosterone, menopause does not decrease sexual desire. However, when vaginal changes create discomfort during intercourse or the woman suffers from other interfering health problems, menopause may mean a decline in intercourse. Some women may go through a sexual adjustment where physical responses aren't as extreme as they had been before. In the male, testosterone begins to decrease beginning in the late teens. By the age of 70, testosterone reduction has reached between 30 and 40%. The lowered testosterone and other sexual problems may lead to an old age of impotence. That means they can't have sex. The prostate gland may swell and make urination difficult and erection incomplete. As males wander into their 50s, they may begin to feel their physical decline and waning testosterone level. They may experience depression, anxiety, irritability, insomnia, fatigue, weakness, lower sex drive, erectile failure, memory loss, reduced muscle and bone mass, body hair. Lots and lots of body hair. Many men, as they age greatly, fear the loss of their sexual potency. It isn't true that as males age, they naturally lose their sexual functioning. This is basically a cultural idea. Very often, the lessening of sexual activity is due to non-physiological reasons: monotony in a relationship, preoccupation to business or financial worries, mental or physical fatigue, depression, failure to make sex a high priority, fear or inability to perform. Physiological problems include diabetes, alcohol, and medication. Male sperm count begins to decline when a male is in his late 40s or early 50s. Erections tend to become slower and less firm, orgasms less frequent, ejaculations less forceful. It takes longer to recover and ejaculate again. 39% of 40-year-old men experience some sexual dysfunction. 5% of men in their 40s are unable to get and hold an erection. 67% of males over 70 experience some sexual dysfunction, and 15% are completely impotent. Erectile dysfunction may be caused by diabetes, hypertension, low cholesterol, kidney failure, depression, neurological disorders, alcohol, drugs, smoking, poor sexual techniques, unsatisfying relationships. Aging does not have to spell the doom of a couple's sex life. With many couples, menopause is liberating since the couple no longer has to worry about unwanted pregnancy as a result. The bottom line is that age has nothing to do with sexual drive and desire. Sexual expression may change its focus as a person ages, but couples are able to have sex as frequently as they want to have it. In many families, middle-aged mothers tend to have the role of kin keeper, the person who gathers people together for celebrations and keeps them in touch with one another. Sometimes middle-aged parents are referred to as the sandwich generation because they are sandwiched in between aging parents and difficult adolescent children of their own. During middle adulthood, successful adults are able to maintain their mental capacities by adapting to their circumstance through selection, optimization, and compensation. They are selective as to what they do, they optimize their abilities, they compensate when necessary. By using SOC, the individual is able to maintain their level of competence, regulate their losses by reorganizing their functions, and growing through adaptation. By focusing on what they are good at, middle-aged individuals are able to develop expertise, extensive experience, knowledge, and understanding of a specific area of interest. The antithesis of expertise is a novice, someone with very little experience, knowledge, and understanding of a specific area of interest. People with expertise may have a wealth of knowledge in an area, but will only use a small amount of that knowledge in any one situation, an aspect referred to as conditionalized knowledge. Even experts have different levels of competence. Individuals who have expertise that is basically routine are referred to as merely skilled experts. Those experts who can not only answer routine questions about their subject, but have such extensive knowledge that they have adaptability, flexibility, and creativity are referred to as highly competent experts. Highly competent experts become problem solvers in their field and can create strategies to expand their knowledge and develop new skills. This is known as adaptive expertise. Working memory is a kind of notepad in the mind for storing information in the short term so that it can be dealt with. In fact, working memory used to be referred to as short-term memory. Working memory only holds from 5 to 9 chunks of information at any one time. Working memory can be enhanced if the individual arranges information in larger chunks. Still, the working memory can only hold information for about 30 seconds before it begins to decay and possibly distort. Another enhancement tool that is frequently used is rehearsal, where the individual re-enters the information into the working memory by repeating the information. Researchers feel that as we age, the capacity of our working memory tends to shrink. Shrinkage tends to have a great deal to do with the complexity of the task required and the technique used in memory enhancement. If the individual is using rehearsal as their memory technique, they tend to show very little decline. Any information that requires more sophisticated memory enhancement tools, such as reorganization, elaboration, or mental manipulation, there is greater decline. Some researchers feel that as a person ages, they lose attentional resources. They have less ability to maintain their attention on a select item. However, other researchers cite motivational lapses that might preclude an older individual from trying too hard on such nonsense. And this is, of course, why in the world, if you've ever seen these memory tests, you go on, who would do this? Why would you do this? Scientists have recently been researching how select information is processed. Explicit memory is conscious or intentional recollection, most often facts, names, events, or other things that people can state or declare. Implicit memory is memory that occurs without conscious awareness, most often skills and habits, throwing a ball or riding a bike. Brain scans of people recalling implicit memory shows that there is a specific memory pathway that takes place when recalling this information. There have been some interesting findings looking at the effect of sex hormones and memory. Dealing with animal studies, researchers have discovered that increased estrogen levels, as with birth control pills and hormone replacement therapy, decreases a woman's spatial reference memory, memory for location and space. Looking at male subjects, they found that when they increased testosterone, they increased spatial reference memory. Many parents, especially some women, so strongly identify with their mothering role that when their last child finally leaves the house, they may suffer from bouts of loneliness and feelings of worthlessness because their role has changed from the center of their children's lives to the periphery. This is known as the empty nest syndrome. Fathers also may suffer from empty nest in that they may regret not having spent more time with their children. Do opposites attract? Well, not usually. Most people fall in love with and marry someone much like themselves, and this is known as assortative mating. In fact, people who are about equally attractive are the most likely to develop close relationships. Lovers often resemble each other in physical appearance, attractiveness, mental health, physical health, intelligence, popularity, and warmth. They are likely to be similar in the degree to which their parents are happy as individuals and as couples. Couples tend to be similar as to their socioeconomic status, race, religion, education, and income. They often have similar temperaments. They often have similar interests. Researchers have found that people are usually more cognizant of why a failed relationship dissolved than why they got together in the first place. And as you can see, people look alike. They kind of, and it's the interesting thing is the color of their hair. Well, the color of her hair is right there, and it's about the same as his. Yeah, there we go. Yeah. And once again, same color of hair. They could be brother and sister. Her hair's a little darker than his. There we go. Same color. Same color. Same color. Same color. Almost blonde. Got a little off brown. Of course, they're not together anymore. They're not together anymore. Later years, the ability of older couples to handle the ups and downs of marriage results from mutual supportiveness, intimacy, sexual, emotional, interdependence, sharing of tasks and resources, the partner's sense of belonging to each other. In the United States, the average age of grandparents at first grandchild is 50 for women and 52 for men. Minorities usually achieve grandparenthood at a younger age than whites. 75% of older Americans are grandparents. 40% are great-grandparents. Families are getting smaller. They are about a third as large as they were at the turn of the 20th century. And I was a grandfather at, let's see, he just turned 11. And I'm 73, so I was a grandfather at 62. In developing countries, the role of the grandparent is one of counselor and financial benefactor. In the United States, grandparents often act as teacher, caretaker, role model, and negotiator, but this is only about 15% of grandparents. Involved grandparenthood represents about 15% of grandparents. They are involved to the extent of disciplining or correcting their grandchildren. They give advice. They discuss the child's problems. They're consulted on important decisions concerning the child. They exchange help with errands and chores and projects. Younger grandparents, those who see their grandchildren almost every day, and those who have a close relationship with the child's mother, are more likely to be involved. Grandparenting styles may differ from with different grandchildren and at times in a child's life. The most involved years tend to be when the grandchildren are pre-adolescent. One researcher from the 80s sees grandparents as family watchdogs. They often stay on the fringes of their children and grandchildren's lives, rarely playing an impactful role unless there is a need. In a crisis, they will step in with financial or emotional support. One study in 1987 found that 14% of preschool children were under the care of grandparents during the daytime. Grandmothers tend to have a closer, warmer relationship than grandfathers with their grandchildren and to serve more often as a surrogate parent. The mother's parents tend to be closer than the father's parents and are more likely to become involved in a crisis. Grandmothers tend to be more satisfied with grandparenting than grandfathers, though grandfathers tend to be warmer to their grandchildren than they were to their children. They feel that it is a second chance to do a better job at parenting than they did with their own children. 7% of children in the United States live in households headed by a grandparent. 1/3 of these children have no parent present in the household. In some low-income areas of the United States, an estimated 30 to 50% of children are living in kinship care, living in households with grandparents or other relatives without their parents. Many of these children may have behavioral or learning problems due to a parent's abuse of alcohol or drugs. 68% of grandparent caregivers are white, 29% are black, 93% of single grandparent caregivers are women, 40% of grandparent caregivers are poor or just above the poverty level. 2/3 of custodial grandparents report a greater sense of purpose in life. Often the age difference between the grandparents and the grandchildren can be a barrier between them. They may feel anger or guilt for raising children who did not take care of their own children. They may feel that it shows that they themselves have somehow failed as parents. Age discrimination refers to denying someone a job or promotion solely on the basis of age. The Age Discrimination Employment Act of 1986 protects workers over 40. This law states that people must be hired based on ability rather than age. This law will not allow employers to hire or fire using age as their sole criteria. The law also keeps employers from segregating or classifying employees using age as the basis for this classification. Research shows that the idea of retirement is not universally accepted. The responses fall into three categories. Those who are so attached to their work that they cannot imagine retiring, that's me. Those who were looking forward to retirement as an opportunity to do things they hadn't done before. Those that had mixed feelings or hadn't yet thought much about retirement. In Germany, only 3% of older adults still work. In Japan, the percentage of older adults still working is 28%. In the United States, 16% of older men and 8% of older women are still in the workforce. In 1900, 67% of men over 65 are still in the workforce. In 1950, 50% of men over 65 were still in the workforce. But remember, in 1950, the life expectancy was only 59. Individuals who continue working tend to be better educated than individuals who retire and tend to be in good health. Many people finance their retirement in various ways. Social insurance, Social Security, universal pensions. Some countries automatically give each retired individual a pension. Voluntary pension plans. Most companies in the United States and Britain are allowed tax deferments to maintain a pension fund. Provident funds, similar to Social Security, but people get it all in one lump sum after they retire. While many people do prepare for retirement, just under half don't even think about it. But even the individuals who plan tend to aim too low. Savings programs need to be maintained at higher levels than most people are maintaining them. What do people do after retirement? Many maintain supplemental paid jobs. People who were self-employed before retirement tended to work at least part-time after retirement. Volunteerism, 1 out of 3 people over 75 do volunteer work. 40% of all retired people do volunteer work. Leisure, people tend to find a focus after retirement. Some people maintain a family-focused lifestyle that means moving closer to grandchildren. Some people maintain a serious leisure where they must maintain skill and concentration in their endeavors. About 11% of U.S. retired people live in poverty. This is down from 35% in 1959 and the vast majority before Franklin Roosevelt passed the Social Security Act. After retirement, age often dictates poor health, but the vast majority of people are fairly healthy, both mentally and physically, until just before they retire. Erikson's 7th crisis occurs at least by the beginning of middle adulthood and lasts until retirement. The crisis involves whether the individual will guide the next generation or whether they will focus on their own needs. This crisis is often resolved as soon as the individual decides to have and raise a family. People who put off relationships and a family are often too self-absorbed to care about generativity. And of course, this crisis is generativity versus stagnation. In 1968, Robert Peck looked at Erikson's idea of generativity and expanded on how people change their focus as they enter middle age, valuing wisdom instead of physical powers, socializing instead of sexualizing human relationships, concentrating on many people rather than investing all of one's time on one individual, mental flexibility instead of mental rigidity. And that is the end of chapter 11. So let's go on to chapter 12. There we go. What are we talking about? Late adulthood. Oh, this is where I am. Oh no. As people pass the 65-year mark, if they make it that far, genetics dictate how much they will wrinkle and how quickly they will look old. Depending on the debts that they have created by smoking, drinking, and perhaps taking drugs, not to mention not getting enough sleep, the changes may be severe or minuscule. The aging process in late adulthood is called senescence. Metabolic inefficiency leads to subtle changes in the body's organ systems. The body will adapt to the decline initially, and the individual will not notice the changes, but eventually the changes will become so extreme that the body can no longer adapt. Collagen is a fibrous protein that is the basic component of the connective tissue throughout the body. As collagen loses its elasticity, wrinkles form and systems weaken. Collagen breakdown is also responsible for lupus erythematosus, scleroderma, and rheumatoid arthritis. All three of those are autoimmune diseases. Asian, African, and Latin cultures have favorable views of elders. Western culture views are becoming more favorable. Western culture is still combating ageism. Some stages of late adulthood, young old, 65 to 74. That's where I am. I'll turn 74 in October. Old, oh jeez, 75 to 84. And oldest old, 85 and above. I'm not there yet. Rising proportions of older adults in developed countries. As you can see, Japan is outstripping everybody. Way to go, Japan. And Germany, strangely enough. Physical changes. Hair continues to gray and thin. Bones thin, especially in women. Age spots develop. Sun exposure hastens development of age spots. Height and weight decline. Teeth yellow. Exercise and healthy diet can slow some appearance changes. As men and women move past 65, they begin losing weight and height. Physical activity decreases, food consumption decreases, metabolism lowers, health tends to decline. Muscle and tissue mass begins to atrophy. It is not uncommon for people over the age of 65 to lose all of their teeth. With the depletion of the immune system, periodontal disease and gingivitis are not rare among the elderly. However, much of their dental problems are due to poor dental practices of the past and neglectful individual practices. In old age, muscles atrophy and bones become brittle. Muscle elasticity is reduced, causing stiffness. If the individual suffers from osteoporosis, scoliosis, which is an S-curved spine, this is scoliosis right there, kyphosis, which is a humpback posture, posture problems are sometimes the results. That's what a normal spine looks like, and that's a kyphotic spine. Overworked joints tend to wear out, and by the time people are in late adulthood, the wear and tear becomes obvious in the form of arthritis and rheumatism. If the joint degenerates too much, it might have to be replaced, but only major joints like knees and hips tend to be replaced. And that's what an artificial hip looks like, and that's what an artificial knee looks like. Another joint problem is gout, and I've had gout since I was 18 years old. Gout is caused by a metabolic disorder that allows uric acid crystals to form in joints. Gout can form anywhere, but is normally found in the feet or ankles. It is most commonly found in the joint of the big toe, and that's what I've got it in my left big toe. It's not that bad. It's not bad at all, actually, because I control it with my diet. Individuals who have cardiovascular problems in middle adulthood have worsening problems as they age. Further accumulation of fatty plaque in the blood vessels leads to easier fatigue when exercising. Exercise decreases, leading to a more sedentary life, which exacerbates their condition. Worsening conditions cause increased blood pressure. As people age and their activity level declines, their lungs lose their flexibility. Stamina decreases, chest muscles and the diaphragm become weaker. Age-related conditions may further reduce chest capacity. Diseases of reduced immunity and reduced capacity may develop lung cancer, emphysema, and pneumonia. And that's what we're seeing right here. This is pneumonia. As people age, their digestive system loses its flexibility to take care of any food that you may try to feed it. The chemical structure of digestive juices change. Digestive disorders begin to appear, especially if stress has bothered digestion at a younger age, causing constipation, hernia, gallbladder problems, gastritis, which is another name for heartburn, and diverticulitis. And this is diverticulitis. This is what diverticulitis looks like. Don't get it. Ugh. It's these little pockets that form, and they can become infected. And you don't want this. This is not good. What did I read? Oh, now they're talking about pooping. For the longest time, I've complained that nobody talks about pooping. But now they've decided that they're going to tell people how many times they should poop. If you poop every day, you're in good shape. If you only poop 2 or 3 times a week, then you've got what they call constipation, and this isn't good. Constipation. You can have chronic constipation where that's all you've ever defecated is 2 or 3 times a week. But somewhere you don't have to poop every day. But if you do, that's really good. But if you don't, then you need to clear that crap out. 5 or 6 times a week is good. So do we need to take laxatives? The answer is don't if you don't have to, certainly. But if you're chronically constipated, you need to figure something out. Doctor needs to help you. 2 ways that you can help clean out your colon, your bowels. One is to drink clear water. Will do it. And another is exercise. If you don't get exercise and you aren't drinking clear water, then potentially you'll become constipated. So there you go. Exercise and water will do it. There is a reason why older people discuss their bowel movements, because the lifestyle reduces movement. Bowel regularity is reduced because of a more sedentary daily routine. The result is problems of the colon and rectum, constipation, as we just talked about. You need to defecate 5 or 6 times a week, or 5 or 6 times a week. Yeah, that was correct. Once a day is good. If you're defecating more than that, that's fine. If you're defecating a lot more than that, you probably need to slow things down. It was interesting. My mother was a nurse, so she knew that she and my dad needed to have regular bowels, and she had a problem with going too much, and he had a problem not going enough. My father's side of the family has chronic constipation, or did. Well, anyway, they have chronic constipation. So in order to get his bowels to move, she would give him Metamucil. And in order to get her bowels to slow down, she would take Metamucil. So every morning they took Metamucil together, one of them to speed things up and the other to slow things down. It's really kind of interesting. But she was smart enough to figure all that. Oh, well, she's a smart lady anyway. She told me what to do. And another problem my family has had is hemorrhoids. And there you go. That's what a hemorrhoid looks like. This is your rectum. Yeah, this is what it's supposed to look like. Your rectum. This is what it does look like. It's got this pocket. And this is usually filled with blood. And sometimes this can pop and cause all kinds of interesting problems. The concept of high and low fiber hasn't been around for very long. For this reason, most of the World War II and baby boom generations didn't understand how to combat the horrors of constipation and hemorrhoids. Now we know that while genes dictate digestive structures, high fiber diets can very often alleviate diverticulitis as well as constipation and hemorrhoids. And of course, these are high fiber foods. Any fruits, any vegetables are high fiber. Popcorn is good. Oatmeal is really good. Yeah, there you go. So anything that's a grain. So all of your grains are good for you. As people move into old age and slip into a more sedentary lifestyle, they tend to gain weight, many to the point of obesity. As connective tissue weakens, a portion of the stomach may slide up next to the esophagus, leading to indigestion, gastritis, chest pain, and difficulty swallowing. This condition is known as a hiatal hernia, and that's what it looks like, hiatal hernia. Not a good thing. It means that you don't get enough exercise. Another problem can be attributed to low fiber diets is diverticulitis. Diverticula are weakening of the colon wall causing pockets to form. These pockets can become inflamed and cause pain, nausea, constipation, diarrhea, and perforation. And if it perforates, then you've got to go in and take care of it, because then you've got digestive juices which are full of bacteria leaking into your thorax, and that's going to cause problems. It's going to cause an infection, and you don't want that. The gallbladder's function is to hold and concentrate bile for the digestion of fats. With age, the efficiency of the gallbladder is reduced. If the individual continues to maintain a high-fiber diet, high-fat diet, they may develop gallstones, which can block the bile duct, causing inflammation or gallbladder disease. And my mother suffered from gallbladder disease, had her gallbladder taken out, and that's one of the reasons. So now she couldn't break down fat as well as she could before, and that's one of the reasons why she had frequent bowel movements, frequent and loose stool, as it were, and it's because of her gallbladder, or lack thereof. As people age, most of their bodily functions suffer because blood flow decreases and their organs become less efficient. Sometimes the individual may lose their bladder control and suffer from involuntary leakage, a condition known as incontinence. The most common genitourinary problem for men is an enlarged prostate from sexual abstinence or contracting STIs. Sexually transmitted infections. As the prostate encircles the urethra, enlargement leads to a blockage of urine flow. Urine flow problems can lead to increased bladder infections, And the biggest problem is that your bladder doesn't empty completely because it shuts off because of the swollen prostate. This is what a prostate's supposed to look like. This is what a swollen prostate looks like. Despite the troublesome prostate gland, women tend to have more urinary problems than men. Part of this problem has to do with the shorter urethra and proximity of the vagina. Bladder infections may lead to inflammation of the bladder, a condition known as cystitis. Other genitourinary problems that women may have include infections in the vaginal area, prolapsed uterus, and cancer of the vulva or cervix. As the individual ages, there are significant changes in the central nervous system. The speed of nerve cell transmission slows, brain and nerve cells diminish in number. More sedentary lifestyle leads to a decrease in oxygen transport to the brain. Reaction time decreases. Now, I keep mentioning this word right here, sedentary, sedentary, sedentary. That means you slow down. Everything slows down. It doesn't have to be this way. If you maintain a good exercise program, potentially you won't have these problems will be lessened, certainly. Because of the decreased reaction time, perception, memory, and some reflexes are affected. This is especially true when driving. The decrease of oxygen to the brain can also lead to sleep disturbances, memory problems, general irritability, and insomnia. Vision tends to decline as people reach late adulthood. A greater threshold of light is required to stimulate the retinal cells. Acuity decreases due to changes in the lens, pupil size, and ability to focus. Decrease in the ability to adapt to light and dark. Eye disorders that affect late adulthood, floaters in the visual field. Here, let's go to floaters. This is what a floater looks like, I think. If I can find it. They still have them. They still have it. Eye floaters and flashes. These are called floaters. These chunks of nothing. Yeah. Okay, floaters. So you can have floaters, and we saw what those look like. This is what they actually look like. And I've had floaters. I usually get floaters when at the end of a semester, when I'm really tired and I got all that stuff to grade. Thank you very much. Cataracts, glaucoma, drooping eyelids, macular degeneration. This is what macular degeneration looks like. This is what a cataract looks like. A macular degeneration is caused by a decreased blood supply to the retina, causing poor vision when looking directly at something, though peripheral vision tends to be sharp, but that's what it looks like. Hearing is the most frequently lost sense as people age. About half of people over 65 have some degree of hearing loss. Males tend to have earlier and greater hearing losses, mostly because many jobs require being around loud noises, like gunfire. High-frequency sounds are usually the first to go, but low-frequency loss may increase as people age. For most people, their sense of taste and ability to smell decline with age. Taste declines because of the loss of taste buds, which forces the individual to over-season their food in order to improve the taste. In a like manner, the odor receptors in the nose decrease in number. This can lead to not being aware of their own odor, as well as not detecting smoke from burning food or unpleasant odors that permeate their house. What if old people smell normal and we are the ones who smell funny? Keanu, maybe that's true. Quality of sleep declines with age. Sleep less deeply. The time in light sleep increases. Sleep apnea is a common sleep problem. It can be treated with a CPAP device. Psychological issues can also impair sleep, depression, anxiety, and medical conditions. Though most older individuals have one or more chronic conditions, they are in relatively good health. The most common complaints include cardiovascular disease, hypertension, arthritis, hearing impairment, cataract, glaucoma, and lower back pain. Older adults are less likely to get acute illnesses, but when they do, they tend to be more severe and last longer than with younger individuals. Because of this, hospitalization occurs more frequently. Common acute diseases may lead to a weakening condition that quickly degenerates into a life-threatening illness. Exercise, diet, and health needs continue to be top priorities through late adulthood. Because food may not taste as good to them, older people may start eating less or eating less nutritious food, preferring food with a strong taste. Fluids may not have the same zing they once had, so drinking water becomes an afterthought and the individual becomes dehydrated. And this happened to my mother, and she used to keep a glass of water. She used to sit watching television with a glass of water, and her greatest joy was when the cat would come and drink her water for her, so she didn't have to worry about it. She was funny. Because older adults have questionable eating habits, diets high in tasty fats and proteins increase the person's susceptibility to cancers, colon cancer, uterine cancer, breast cancer, prostate cancer, kidney cancer, and pancreatic cancer. There are a number of factors that lead to poor nutrition as people get older. Loss of teeth, enjoyment of food declines because of the loss of taste and smell, fixed incomes that limit the purchase of good food, physical problems that limit shopping, forgetting to eat, loss of appetite. Because they are losing weight, older people assume they are eating a balanced diet. Strokes, referred to in medicine as cerebrovascular accidents, begin to happen with greater frequency as people get older or snort cocaine. Well, that's true. A stroke is when a portion of the brain dies because oxygenated blood is unable to get to the area due to a blood clot or hemorrhage. I didn't mean that older people are snorting cocaine. I mean that snorting cocaine can cause a stroke. That's what I meant. Blood clot or hemorrhage. An aneurysm is when the blood vessel wall weakens, allowing a herniated wall. And this is what an aneurysm looks like. Whoops, I don't have an arrow. Wait a minute. This is what an aneurysm looks like. And this is what an aneurysm looks like. The expansion of the wall may cause a ballooning effect that puts pressure on portions of the brain, causing various symptoms. If detected, an aneurysm may be surgically repaired. If not detected or impossible to repair, and a lot of the aneurysms in the middle of your head are not going to be repairable. They cannot just, shoot in there and take care of the aneurysm. A lot of times it's impossible for them to do surgery. The aneurysm may hemorrhage and cause damage to the point of death, and usually, depending on what blood vessel we're talking about, if there's a lot of blood that goes through here, when this person's aneurysm pops, hemorrhages, then they're going to bleed out, and they usually bleed out fairly quickly. They can bleed out fairly quickly. If it's a vein, not that big. Well, it is still a big deal, but if it's an artery, that's a lot of blood. Stroke severity usually has to do with the location and how extensive the damage is. Some strokes only show minimal damage, while others cause total paralysis and loss of speech. Sometimes after a stroke, the brain is able to reroute the operation of a function, so they have near total recovery. And my brother-in-law had a stroke, but he's recovered completely, as interesting as that is. At least my sister says he has. Signs of a stroke: sudden temporary weakness in the face, arms, or legs, difficulty speaking, difficulty seeing, unexplained headaches, dizziness, change in personality, change in intellectual function. The younger someone is when they have the stroke, the more likely that they will recover, and it's because of resilience. Stick out your tongue to check for signs of stroke, and that's what you ask them to do, to stick their tongue out. And if they stick their tongue out and they have had a stroke, then one side will be weaker than the other, and they won't be able to stick their tongue out correctly. So if you think somebody's had a stroke, you can ask them to stick their tongue out. And if they have difficulty doing that, then you know that they've had a stroke, and you need to get them to to the emergency room as soon as possible. There is a shot, and I think we're going to be talking about it. No, I guess we're not. They can give them a shot that will, if it's a blood clot, it will dissolve the blood clot and their stroke will go away. I can't remember what it is. It has 3 medications in it. And it's an acronym. One of the greatest fears of older adults is that they will lose their mental capacities or drift into senility, the loss of reality, being helpless, developing incontinence. Another name for senility is dementia, a loss of brain capacity that gets acceleratingly worse, since if you don't use it, you lose it. One of the main symptoms of dementia is inexplicable confusion and frustration. Alzheimer's disease is an irreversible dementia that strikes some individuals. People with Alzheimer's tend to lose their intellectual functions fairly rapidly until they can no longer control their bodily functions and they die. Alzheimer's disease is caused by the loss of nerve cells due to the death and decay of neurons and the production of a protein that begins to accelerate the process. This protein is known as amyloid plaque, and that's what it looks like. Besides the buildup of amyloid plaque, and you can see the chunks right here, around the neurons, protein filaments called neurofibrillary tangles develop inside the neurons and make them non-functional. When this occurs in the area of the brain that produces acetylcholine, the individual rapidly loses memory and function. Formation of amyloid plaque and neurofibrillary tangles is normal as we age. The difference between normal formation and rapid formation in Alzheimer's seems to be the rapidity in formation and the area of the brain where the formation takes place. Alzheimer's disease does not usually present itself profoundly in the beginning. The individual may garble messages or go on sudden spending binges. The individual will also become confused, irritable, restless, agitated, with impaired judgment, concentration, orientation, and speech. Parkinson's disease is characterized by motor symptoms, slow walking, difficulty getting out of chairs, slow hand tremors. The disease is caused by the deterioration of dopamine-producing cells in the substantia nigra. Since Parkinson's disease is caused by a degeneration of brain cells, one area of research that seems as if it might have rich potential to alleviate the symptoms is stem cell research. Unfortunately, people with little understanding of the source of stem cells have blocked stem cell research in the United States because of the abundance of stem cells in fetal tissues, embryonic stem cells, and umbilical cord stem cells. There are also adult stem cells. Most stem cells have the capability of forming similar cells to the cells in their proximity, and this is known as equipotentiality. Cancer is the second leading cause of death in older adults after cardiovascular disease. Half of all diagnosed cancers and more than 60% of all deaths due to cancer are in people over the age of 65. While some cancers are easier to treat, lung cancer deaths have risen 104% in men and a whopping 452% in women since 1960. Some cancers do seem to be genetic in nature, but others are caused by overstimulation and abuse, such as smoking tobacco, or drinking, or taking drugs. The U.S. culture focuses on and promotes youthfulness. Even commercials aimed at older people have actors who are just barely old enough to represent their age group. This is known as ageism, prejudice against old people, and gerontophobia, fear of old people. Gerontophobia. As people age, they tend to have less energy and must use their expertise to compete with those with more drive. They must maximize their gains and minimize their losses whenever possible. They must be selective about which tasks they attempt. They must optimize the energy they put into tasks. They must compensate for losses by refocusing energy where it can do the most good. SOC theory, selection optimization, and compensation is what we try to do. Wisdom, like intelligence and creativity, is almost impossible to define. Wisdom seems to be a deep understanding of knowledge and one's limitations, an understanding of what is automatic and why, an understanding of what is known and what it means. The most frequent problem that you hear when you talk to people over 65 is that they don't remember things like they used to. Memory searches tend to take longer. The degree of slowdown tends to depend on the level of mental activity. The more cognitively active you are, the less rapid the decline. Episodic memory declines with age. The working memory, memory involved with handling simultaneous thoughts. Source memory, the ability to remember where you heard, learned, or saw something. Explicit memory, information you purposefully recall. Semantic memory, or general knowledge, remains intact despite an individual's advanced years. Procedural knowledge, such as driving a car or riding a bike, remain unchanged into geriatrics. Implicit memory, unconscious memory that guides our behavior and feelings, does not change with age. Primary short-term memory that allows us to consciously maintain information in our short-term memory does not decline with age. I occasionally need to read my tweets to remember what I was doing. One of the interesting things, and this is kind of off topic, but I'm just wondering if people are relying on Google to remember things, or they don't have to remember things anymore because they can look everything up. I'm just wondering if that is going to affect our ability to remember things in the future for those individuals. Millennials who think that they can find anything online and believe everything they read online. That's another problem. But if you don't use it, you lose it. And I'm just wondering if they're going to have a problem with memory in the future. Just a thought. So remembering things is not a bad thing. It's like practice. IQ scores of people in late adulthood show a steady decline. Problem solving, speed of performance, verbal skills tend to show no decline. Further research seems to show that difficulty, except saying gerontophobia, there we go. Further research seems to show that difficulty solving problems may have more to do with new and unfamiliar information, such as DVD players and smartphones. While speaking is rarely a problem unless you have organic problems such as dementia or stroke, reading is quite an involved process. Working memory, processing speed, and inhibition are areas that decline with age, and all of these contribute to the reading process. Other reading processes include vision, comprehending the words, syntax, semantics, integration of words into a whole, context, and pragmatics. While older adults and younger adults process language in a very similar manner, research shows that younger adults tend to pause longer at the end of sentences. Younger readers spend much of their time on vocabulary and concepts. Older readers infer more from context and spend their time connecting new information with old information. One area of research has tried to discover why older individuals tend to drift off into irrelevant topics when speaking, and this is known as off-target verbosity. Research has speculated that this trend may be caused by various circumstances: lower frontal lobe functioning in the brain, psychosocial stress, extroverted personality, smaller social networks, lower social support. People tend to speak to older adults in a similar manner to the way they speak to infants and small children. Some of this is because hearing loss is common among older adults. Some has to do with the proclivity of dementia, but some of it may be tied to negative stereotypes. Today you're going to learn a new language. Elders speak egg, eggy, weggy. Drink, drinky, winky. Sleep, nighty, nighty. Okay, that's a joke. While there isn't a switch that flips to old when you reach 65, to pretend that there isn't a continual decline into old age would be illogical. While most of the decline is physical, there are social and family changes that occur as well. The individual will probably stop working at some point. Creativity and discovery lose their allure, and the new focus is on maintenance and quality of lifestyle. Focus is on what is happening to the individual rather than what is happening to others. Older people report having fewer intense negative emotions than when they were younger. Some studies show lower intensity to positive emotions as well. Positive emotion, though less intense, increase in frequency into very late adulthood. Emotional control is equated with healthy coping, especially in late adulthood. Robert Peck has speculated that older adults go through three personality adjustments. The first is ego differentiation versus work role preoccupation. This refers to the adjustment that must be made from an individual's work role to that of retirement. With retirement, the individual can't refer to themselves as what they do and now must adjust to identifying themselves in other terms. The second adjustment is body transcendence versus body preoccupation. As the body changes in old age, unless the individual allows themselves to age gracefully and accepts the changes, they will be distressed by who they become. The focus needs to change to the external. And I've got better arms than that guy does. A lot better arms than that guy has. The last elderly challenge is ego transcendence versus ego preoccupation. This involves accepting one's impending death by living life to the fullest. This also involves trying to help those who will survive you. Researchers have identified four basic personality types among older adults: integrated, armored defended, passive dependent, and unintegrated. People with an integrated personality are well adjusted and flexible in their approach to life. There are three types of integrated people. Reorganizers are very active and rearrange their lives by substituting new roles. Focused people reserve their energies for a few new roles. Disengaged have low levels of energy but are satisfied with their lives. I'm guessing this is the brother and these are the sisters. I'm guessing that's what's going on there. People who are armored defended seek to gird themselves against anxiety and other threats against their well-being. They come in two types: those who cling to their middle-aged activities, including employment past when others have retired, and I guess that's me. Those who withdraw from activities as a defense against old age. There you go. That's me. That's what I look like. That's more like what I look like, I guess. Passive dependent people have a difficult time with others. Some establish a strong dependency for someone. Some are totally apathetic toward others and their surroundings. People who display an unintegrated personality are described as people suffering from dementia. They have poor emotional control, disorganized thought processes. Retirees obviously have more time for leisure activities than they did when they were working. Leisure activities for older adults tend to be less physical than the activities of a younger age. Religiosity is incorporating a spirituality with a social aspect of life, living their spirituality in a group context. As people move into late adulthood, their religiosity tends to increase. Women have higher religiosity than men. African American and Latinos have higher religiosity than European Americans. Religiosity is associated with better physical health, better mental health, longevity, better coping skills, greater sense of well-being. Someone has to go first. When a spouse dies, the surviving spouse has entered widowhood. And of course, this is the Black Widow. That's why I've got her picture up there. More women are widows than men are widowers. Widowhood may mean remarriage, retraining or education for jobs, re-entry into the workforce, participating in voluntary organizations and activities, devoting additional time and effort into parenting and grandparenting. When a person becomes a widow, they have the following needs. They experience bereavement and express grief. They explore companionship needs, especially if the death is the first adult experience in being alone, dealing with the good intentions of others, seeking experiences that build self-confidence, personal skills, and competencies, gaining assistance and re-engaging socially with others. Men who lose their spouses tend to have a more extreme reaction, mainly due to the fact that men tend not to have a close confidant like women do. Loneliness and depression are common reactions. When widowhood and retirement happen at the same time, things may be devastating. Suicide is not uncommon in such circumstances. As people age, their cohorts die out around them, and they lose that automatic social support that they have always had. Friendship provides psychological intimacy and camaraderie. People in late adulthood tend to optimize their social networks by ending peripheral and negative relationships and focusing on happy, fulfilling relationships. The average person spends 10 to 15 years in retirement. Old adults fit one of 5 lifestyle patterns. They continue to work full-time. They continue to work part-time. They retire and become active in volunteer work. They retire and become active in recreational leisure activities. They retire and later return to work full-time. There are many factors in play determining when an individual will retire. Age when you can receive Social Security. If you retire at 62, you get 75%. If you retire at 65, you get 100%. If you retire at 70, you get 132%, which means you accumulated all this Social Security over the years. If you retire at 65, you get it all. You get all of the percentages of money you get back. If you retire at 62, you only get 75%, but if you retire at 70, you get 132%. So you get more than you actually put in, kind of. I retired at 70, so my Social Security check is pretty big. It's about $2,500 a month. Yeah, it's about $2,500 a month. You can multiply that times 12 and figure out how much Social Security I'm getting. And they have to pay me. I mean, I had to take it after age 70. I couldn't say no. So they start sending it to you. So I not only get a paycheck from Dene College, but I also get a Social Security check every month. Social or economic reasons force early retirement or older work needs. Inability to do work-related activities forces the individual to retire. So you may be asking yourself, when are you going to retire, Bradway? What the hell's wrong with you? And the answer is when I start to slip. And I'm starting to slip a little bit. And when I slip enough that I can't grade and I can't lecture, then I'll quit. I promise. I'll get out of your hair. People who are forced to retire due to health or occupational health limits are not as happy as people who retire of their own free will. People who are flexible and develop hobbies, interests, and friendships that are not work-related adjust better to retirement. Having a sufficient financial base for retirement means to start making plans and saving in later early adulthood or early middle adulthood. While retirement seems like something you do on a select day, the reality is that it usually takes place in stages. Pre-retirement takes place in 2 substages. The first substage is denial and a negative attitude that you will need to worry about it. The second substage is when people realize that retirement is fast approaching and they must make plans to get caught with nowhere to go. Darn it, I saved too much for retirement, said nobody ever, and that's true. Directly after retirement, most people feel happy and peaceful due to their new independence. Time tends to be taken up with getting projects done that people have been putting off for years. After all the projects are completed or discarded as petty, the individual might begin a cycle of depression as they realize that they have withdrawn from a fulfilling social structure for isolation and loneliness. They may feel at loose ends. Many people may take up volunteer work, travel if they can afford it, or new hobbies. They must find meaningful and enjoyable ways to spend their time. Once they have dealt with their new lives, people will make a realistic appraisal of their options for the future. Volunteer work may be too much like work with inadequate rewards. Hobbies may be boring and lonely. Others may find volunteer work highly rewarding and hobbies intensely satisfying. People get in a routine that becomes established and remains stable. They accept their new role and no longer miss their working lives. Expectations change as do behavioral standards and social norms. People will stay in the stable stage until they are either forced back into the workforce for one reason or another, or they become so debilitated that they can no longer function independently. About 1/3 of retirees return to work for financial reasons. The last stage of Erickson's psychosocial theory is a sense of integrity versus a sense of despair. This crisis normally takes place as we are in our last years of life. An individual will look back and either see that their life has been full and rich, or they will look back wishing they could make amends for some of the things that they have done. Never regret. If it's good, it's wonderful. If it's bad, it's experience. And that's one way to look at things. And that's the end of the lecture. So next week we'll put these we'll take care of these old people. But what is next week? Wait a second. Chapter 13. It's a short chapter, so it's not that big a deal. Talk to you guys next week.